This morning I'm going to talk about some aspects of surgery in pancreatic cancer. I'm going to give you some good news, I'm going to give you some surprising news, and I'm going to give you some new news. Generally speaking, most people who are diagnosed with pancreatic cancer die within the year of diagnosis. And so those numbers with regards to new diagnoses and death rate are fairly equal. Unfortunately, only about 10 to 15% of patients with pancreatic cancer actually fit these criteria. So most of the time when a patient comes to the attention of a physician, the patient already has metastatic disease or other reasons not to operate. So if the tumor is less than 2 centimeters in size, it's a T1. If the tumor is greater than 2 centimeters in size, we call it a T2 tumor. If it's growing into the structures around the pancreas, like the duodenum, it's a T3 tumor. And if it's growing into one of those blood vessels we talked about, we consider that a T4 tumor. And then the pathologists look at the lymph nodes to see if there's any disease in the nodes, and if there's no disease, N0, or disease in the nodes, N1. And then the patient either has or does not have metastatic disease. So we're looking to see what the relationship is of the tumor to all of these structures. The tumor is confined to the pancreas, then it's a T1 or T2 tumor, but when it grows to the duodenum, a T3, and then to these blood vessels, a T4 tumor. The patients that are operated on since 1995 are actually doing better. So this is the 5-year survival of that group compared to the older group, 1987 to 1995. And the 5-year survival of this newer group is just above 40%. Those patients who had less operative blood loss had a much longer 5-year survival. This graph here, the patients who had less than 400 cc's of blood loss had a 5-year survival that was about 36%, and those that had greater than 400 cc's had a 5-year survival in the mid-20s. About 15% of patients with pancreatic cancer are candidates to go to the operating room based on the things that I talked about. And currently, it's thought that the only chance for cure is to remove the tumor. 51% of patients with stage 1 disease never make it to the OR, never were offered a surgery. Why is that? Maybe it's because physicians are pessimistic, maybe they're being cared for in places that they don't have as much experience with. Certainly getting back to issues of race and socioeconomic status, that seemed to be a risk factor for not being offered an operation. If you were taken care of, if you had Medicaid or Medicare, you were less likely to be offered an operation. If the tumor was located in the head of the pancreas rather than the tail, you were less likely to be offered an operation, maybe because of the complexity of the procedure. But it's alarming to think that over half the patients in the US with stage 1 disease are never offered the possibility of resection. So the next trick is going to be able to figure out how to do early detection so that more people can go to the operating room.